Hey everybody, and welcome to the Dr. Mom Show. I am Dr. D, mom of three, your host. Thank you once again for joining us. Whether you're watching or listening to the podcast, we're so excited that you're taking time out to be with us today. And of course, I hope you're enjoying season 3. This month, we are focusing on lots of things. We're focusing on how we can be even more amazing women, because this month we celebrated Mother's Day. That's right, but every day is Mother's Day, right? Because moms are that special. Mother's Day is just an extra special day where you are obligated to buy your mom a present. So all the other gifts are surprise gifts and just because. And of course, if you missed any of the other Dr. Mom Show episodes, definitely check those out so you can catch up on what's going on and you don't miss out on some amazing nuggets that our guests and experts are dropping. And of course, on here on the Dr. Mom Show, this is a medical informational resource. It does not take the place of your physician or your child's physician. So please make sure you seek your medical advice or your child's medical advice from your own physician. And finally, I just want to thank Alea Publishing. Shout out to Alea Publishing for sponsoring this portion of the show. Turn your vision into legacy by publishing your story or whatever creative writing you want to publish. It's something that we enjoy. So check out aleapublishingllc.com. Well, today, ladies and gentlemen, of course, you never hear this show or see it without me being super excited, because I always have such amazing, such empowering, just such great guests. And today I feel so special and privileged to have such a special guest on today. I know her story will speak to everybody who is listening and watching in some way, shape, or form. Today I have Miss Sharon Spencer on with me. Woo! Welcome, Miss Sharon.
Hi, how are you today?
Good, good. Thank you so much for being on today.
Thank you. Thank you. Thank you for having me on.
Oh, of course, of course. So just a little bit more about Miss Sharon before we get into our show today, which is called Finding Your Purpose. So Miss Sharon, she has been through so much. When I say the word resilience, I just feel like Webster's dictionary should put her picture next to the word resilience, because when you hear her story, I tell you what, the majority of people would probably give up, but she has challenged my life in just meeting her. And I haven't even met her in person. So that's why I'm so excited that she's taken time out to share her story. So again, just a little bit about Miss Sharon. She is a breast cancer survivor. Whoop, whoop. Shout out to all our breast cancer survivors.
Yes.
And due to a terrible car accident, she is also an above the knee amputee. You guys see what I'm talking about now? But through all her struggles, she has decided to turn her lemons into lemonade, right?
Yes.
Can you guys say that? It's really hard to take a situation like that and turn that into something positive. But she only hasn't been through that. She has taken that, and she is a public speaker. She's a single mom. Big ups to the single moms, especially, and an activist for breast cancer. But she's also taken all her experiences and has started to write. She is a poet and writes about the struggle of cancer, limb loss, self-esteem, single mom, just respect in general. And she knows that God has her on this big assignment. That's right. And that's why we're talking about purpose today. And she just looks at how important it is that even when you lose things and something bad happens, to look at the bigger picture in order to discover your true purpose. And she is so proud to be who she is today, because she's helped so many people through her poetry. And I'm so excited because she'll be sharing that with you today. So welcome again, Miss Sharon. Woo!
Thank you for that wonderful introduction.
Yes, of course, of course. So, Miss Sharon, I know we have a lot to cover today because you've just been through so much, and I really want you to share everything with the audience and just like how you made it through. So I want you to tell us a little bit about your diagnosis of breast cancer and how that happened.
Well, it started with a hysterectomy in 2006, in February of 2006. I was 39, and the doctor said to me, you should go and take a mammogram. So after the hysterectomy, I went to take my first mammogram. And I wasn't worried because nobody in my family had ever had breast cancer. And also, you know, I was healthy, I ate well, I did what I had to do, and I took good care of myself. And I went for my first mammogram, and the doctor saw something cloudy and sent me for two biopsies. And I was diagnosed with breast cancer 4 days after my 40th birthday.
Huh.
Devastated and
Yeah.
shocked, of course. I was told that I would have to have a mastectomy on my right breast. So I was just like, this is not happening. But I know it had to happen. So I took care of the mastectomy. I had the mastectomy December 15th of 2006. And I
Mm.
was asked to be in the study for chemotherapy in 2007, which I kind of regret. I thought I would be helping people, but it was so hard on me. I developed a hernia. I got pneumonia with the first treatment. I was really, really sick. Like, it was bad. So that was my journey with the cancer. Of course, the beautiful long hair came out, but I wasn't too worried about that. I was more worried about just, being okay with the breast cancer
Yeah.
and being cancer free,
Yeah.
you
No,
know.
definitely. And for those of you watching and listening, that was very young. And of course, we look at risk factors. Normal breast cancer screening starts at 40. Just so you know, out
Mhm.
there, usually if there's a family history, we can start as early as 35. Or if you have a super early history of breast cancer in your family, we normally start 10 years before that diagnosis. So let's say you have a sibling who was diagnosed at the age of 30, then your
Mhm.
screening would start at 20. So
Mhm.
pretty aggressive screening. And you may be thinking, hey, how did that pop up? Why did her doctor bring that up? But there is a known association between like uterine cancer and breast cancer. It just has to do with all the hormones that are involved. I'm glad that your physician was proactive, and I'm glad that you were compliant with getting tested, even though you were so young and you really didn't have that family history. So our assumption is that you are cancer free today.
Yes, this is
Woo!
I'm going. Yes, thank you. I'm going into my 15th year of breast cancer free.
That's right.
So it
15
has
years. You
been,
guys hear that? That's so awesome.
yes, I go to my mammogram. I get my mammograms every year faithfully. And I just pray and just, I just keep going
That's
because you
right.
have to.
Awesome. Wow. Well, how has your journey with breast cancer, how's that changed your life? Like, what's one thing going through that journey changed for you?
Oh, it's changed so many things. It's changed, oh gosh, how I look at life. It's changed how I help other people going through it, and I find peace in that, and it makes me feel good to know that I can be that person to tell the next person that's going through, this is what you're going to expect. These are the things you're going to go through. These are the symptoms, these are the feelings. And I also share it through my poetry. I started writing poetry at 50, which I don't even know where that came from, but I know it had to be God because I never did that. That was something I never wanted to do. I never planned on being a public speaker. That's not something that was in my plan. And it just made me understand how life is and just how grateful we should be, and and just how conscious of our bodies we should be as well.
Yeah. Yeah. So
Mhm.
true. So true.
You
Well, we're
know.
going to flip over to the car accident. Tell us a little bit more about that and your leg, what happened.
Well, with the car accident, it was 2 years after the breast cancer. I was out with some friends one night, and what happened was leaving the lounge with my girlfriend, and I walked her to her car with two guys that were in the front of the car. She was in the back of the car. So the car was double parked, and there was a car parked behind me. So out of nowhere, while I'm speaking to her, I'm leaning over. A drunk driver hits the car that I'm speaking to her. He hit that car, which in turn pushed me and pinned me against the parked car. So I'm stuck in the middle, and my leg was amputated above the knee.
Oh my goodness. So
Uh,
it was during the accident that your limb got severed? Oh
yes, my
my
limb got
goodness.
severed. Yes, my limb got severed, and life changed. I thought, and I remember saying, oh, it can't get any worse than this after I had the breast cancer and the hysterectomy. But that's not true. It did get a lot worse. I woke up, I was in Kings County Hospital on trauma, and I woke up and my life was totally different. Everything had changed for me. Everything. And I think I was trying to wrap my head around what had just happened. After I got through the pain and the shock of seeing my leg amputated, on the ground, like that really, that was a nightmare in itself, you know? And it happened so fast. It just happened like a blink of an eye. So it
Mm,
was really, like I said, it was really, really hard. And,
yeah.
yes.
I mean, I can't even imagine. I can't even. And that's like something in a movie that you would see in a movie. Like it's so, because I didn't even realize that you lost your leg during the accident itself. I thought that you were in the accident and ultimately you ended up with like surgically having to get your leg amputated, but that's a whole different ball game. I mean, to the audience, can you imagine that you're just on the street, like minding your own business, doing your own thing, whatever it is, and all of a sudden that happens? Yes, that is a bigger than super duper life changing event that yeah, that's
Well,
insane.
let me just correct you. When I was hit, and I felt, I jerked and I looked down and the pain started because of course the nerves, it went to the brain, the pain, and that's what happened. But the majority of my leg was slipping through my fingers as I'm trying to hold it together. So by the time I got to the hospital, there was really nothing for him to do but just cut off the remaining pieces
What
that were
was
left of
left?
my leg.
Oh my
Yeah,
goodness.
it was devastating. It was very devastating.
Mm,
And it was just shocking. And 2 weeks before I lost my leg, I was visiting a young girl who had lost her leg to cancer.
mm,
Yeah,
mm.
so it was really, and I remember telling someone, if that was me, I don't know, I would just die. She's so young. And 2 weeks
Yeah.
later, I lost my leg. Yeah.
Oh my goodness. And I mean, I'm sure, did you have to like relearn your balance, how to walk, things like that after you had the surgery?
In my head, I believed that I was going to get up and put the leg on and walk the same exact way that I did before. I had never had experience with anyone with a prosthetic. I had never even known anyone who lost a limb personally. So I assumed in my head I was going to just put it on and I was just going to walk just the same way. And I realized very quickly that this was not the case.
Yeah.
And
Yeah.
the higher the injury is, the harder it is for you to learn to walk. Because when you
Yeah.
have the knee, it's easier with the knee because you can bend your own knee. Of course,
Yeah.
I don't have my own knee anymore. So it's very difficult. And younger children seem to do much better, you know, because they're
Yeah.
younger, and I was 42. So it was
Yeah.
really, really hard.
Yeah. And you guys have to remember what like Miss Sharon is talking about. It's almost like all of a sudden you're getting on stilts and somebody says, okay, now you're gonna walk on stilts. Just go ahead. That's not something that you all of a sudden do. So I totally get that. And it's a different balance. It's a different, like she was just talking about with your knee, you know, you have that flexion and range of motion with your knee. Whereas when you don't, and it's a above knee amputation, you're literally having to utilize all the muscles in your hips, all the muscles in your thighs in order to get that traction to move it. Because if you ever
Absolutely.
walk slow motion, you'll see your knee, because of the range of motion in the knee, is kind of what triggers those steps. So yeah, I'm sure that learning curve was super high to learn how to walk with the prosthetic.
It was super hard. It was the hardest thing I ever had to do. It was the hardest things that I ever had to accept. And I tell people that they always ask me, how do you get through this? And I say, um, it's not what happens to you, because there are going to be things that happen to you as long as you're here. Everybody's going to experience something.
That's right.
It's accepting it. That's the hard part. Because I can get from point A to point B very well. I live a productive life. I work. I worked at the hospital. I work at the Barclays Center. So the walking part of it, I got it. But it's the mental part
Yeah.
of what happens to you. That is the hard part that I believe people have a hard time with,
Yeah.
you know? Yes.
Yeah. And you know, that's so true. And again, today we're talking about purpose and finding your purpose. And you know, in Miss Sharon's case and in a lot of people's case, things happen, and it's very easy to say, you know, I have no purpose in life, or because I have breast cancer, I had to get the mastectomy, like I can't do the things I did, or because
Right.
I had to have an amputation, again, I have no purpose in life. But it's not. Today we're here. Miss Sharon is here today to show you. She is like living proof that you can go through things. And I love how she said each one of us go through things. And you know, God
Yes.
says in his word that he never gives us more than we can handle.
No.
So
No.
I mean, Miss Sharon is like a beast. I'm just gonna throw it out there because God obviously knew that this could happen to her. These things could happen to her, and she would get through it and still fulfill her purpose. And you
Yes.
know, I just love that. I love the fact that, and I feel like I don't want to speak for Miss Sharon, but I just want to say I'm pretty sure Miss Sharon didn't wake up. She was like, "Oh, life is unicorns and butterflies, and like it's okay." I'm pretty sure it was a rocky road, and she had to push through to get there. Correct, Miss Sharon?
Oh my goodness, was it a rocky road? Oh gosh, the first couple of years, it was a mourning, because that's a big
Yeah,
part of I had my leg for 42 years. It was like, how do I go from being riding my bike, being athletic, wearing high heels, which I loved, absolutely loved. Everybody knows me for that. And I go from that to not having a leg. That is
yeah,
so, it is just, I don't know. It was the craziest time of my life. It was the darkest time of my life. And I just kept asking God, like, why did you keep me here? Like, why am I going through all, I went through 22 surgeries. Like, why am I here? Like, please explain to
wow,
me why you allowed me to live. Because at that point, I just kept saying, why didn't he just let me go?
yeah,
And I just started really seeking God and going to church and praying and just asking God to show me my purpose, because I started realizing if God kept me here, he has something for me to do.
that's right,
So now I'm
that's
into another stage and I'm trying to figure it out. And the more I got closer to God and drew closer to him, he just started revealing my purpose.
right.
And like I said, I worked at the hospital with cancer patients. I worked at the hospital with people that were going through treatment. And I started to realize that it was a healing for me. It made me feel good. And I'm like, okay, I feel like this is part of my purpose, but this is not my whole purpose. I kept telling people that, but they didn't get it because
Yeah,
God didn't put it in them. He put it in me. So I just I just started publicly speaking, helping other women, limb loss and cancer, breast cancer. And One day I wrote a poem. I wrote a poem for cancer for a fundraiser. And like I said, I never had experience with writing a lot of poetry. That wasn't my thing. I love poetry, but it wasn't enough to, you know, go write poetry and perform it. But God put these words in me, and lo and behold, I started writing about every experience that I had gone through. And I just started seeing it as a platform and a healing for everyone else, that was going through the same thing I've been through, from the limb loss
Yeah.
to the cancer. And I started writing about everything that I've been through. And now I'm trying to get my card line, Resilient Cards, out there. So,
That's right.
you
You heard
know.
her right. She's trying to get a card line out there. I was just so excited about it. I was so excited when she told me that. And one thing she said that really just stuck with me when she was telling me about her cards is that, she received so many cards during her experience, but she said none of the cards had words that really reflected how she was feeling. And I mean, that spoke such volumes to me, I think
Right.
it's so different. For example, being a mom of triplets, of course we're moms out there, but there's just something that you're like, oh my gosh, like really only a mom of triplets could truly feel what's happening in the same way. I'm sure all of us have somebody we know, whether a family member, a friend who's had some sort of cancer, and if you've never been through that experience, you really don't know. You don't know what it is to get that news. You don't know what it is to have side effects to any of the medication. You don't know how it feels after you get a chemo or radiation therapy. You don't know what it is to heal after the surgery. So when she said that, I felt it was so strong. And I love, because you guys on here know that I love it when people turn their pain into purpose and they don't hide it. I'm a firm believer that we shouldn't hide our pain. Sometimes we go through really bad stuff, whatever it is, we go through really bad stuff and we end up hiding it. We end up burying it. But sometimes the best thing to do is talk about it. And even like the better thing to do is to share it, because at least one person has been through that situation. And you guys know, I'm always like, even if it's one person I impact, one person's life that I
Yes.
impact, I change their life, I encourage them, like all the hard work is meant to be. And I just feel that so true with Miss Sharon and what she's doing and the mission she's on.
Yes. God put these words into me for a reason, and like I said, I believe that there's healing in telling your story. I
Yes,
believe that there's healing because you know that you've helped somebody. And
that's
even if,
right.
like you said, if it's just one person, and that's the person that was supposed to hear it, and
That's
that's
right.
fine. And I'm not embarrassed. I'm not ashamed. These things happen. This is real life. Anybody can have breast cancer. Anybody can lose a limb. So
Yeah.
at the big scheme of things, I was like, why am I afraid and ashamed to go tell my story? I have to tell it.
Yeah. No,
You
so
know.
true. And I admire you for that. And,
Thank
everybody
you.
listening and watching, you should use Miss Sharon just as, an example that whatever story you have, don't be afraid, because fear comes in. Fear comes in where people think their story isn't good enough, or who's going to want to hear their story, or what's the point of telling my story, or people are going to judge me if I tell my story. No,
Right.
again, I feel, making yourself vulnerable and sharing your story is really what impacts those around you.
Yes, it's true. And I do respect the fact that God made us all different. I would love for everybody to get up and tell their story, but of course, we realize in life that there are people that are very ashamed or private or
Yeah,
just, bitter or whatever the reason is. And I respect that as well, but I
that's
try
right.
to encourage everybody to get out there and at least try. And you
Yes,
try it on a small scale first,
That's
And then you
right.
go bigger. And that's how you
Yeah,
do it. You start telling, people
that's
little,
right.
yes.
That's right. And I
So,
agree. Not everybody's going to be a speaker. Not everybody is
no.
going to write a book. I mean, but it could be the person sitting next to you at your job. It could be the person on the train next to you. It could be the person on the bus next to you. That one person, a lot of times we never know. I always say, you never know who is about to hurt themselves, and the words that you say to them could make that difference for them to change their mind. And that's why I'm a
Absolutely.
firm believer that we should always have a smile on our face, because you never know, the person who you smile at may think that nobody sees me, nobody, cares about me in the world. But your one smile to that stranger could change their thoughts of how they feel about themselves. So I really do believe that. Well,
Absolutely.
so I know you have your like poems and your card line. So do you know when your cards are going to officially come out?
Well, I'm getting them all together now. I'm going to be on Fox 5 on May 7th, and I'm going to
Ooh,
share my Good Morning America on May 7th, and I'm going to share my cancer poem. And I'm not sure if they are going to allow the amputee poem to be read as well, but in another month, everything will be out.
well,
I'm getting
awesome.
it.
We're
It's
we're
a
so
lot of work.
excited.
It's a lot more work than I expected. I'm still looking for an investor, but I know that God will lead me to the
Yeah,
right person, and I
that's
have
right.
faith in Him. You
That's
know,
right. You guys listening, because we also need to invest in other people and give. Um, so definitely support Miss Sharon. Again, follow her on Instagram at Resilient Cards. Her information's on there. If you want to reach out to her, we'll talk about that towards the end of the show. But all the information will be out there. I'm a person about supporting people, because no matter what, us by ourselves, each individual can't reach the entire world. So I always say there's enough people for everybody. So whatever you're doing, we're all doing, like Miss Sharon said, we're all different and we all have different personalities, and not everybody may like, I'm always excited. So everybody may not like that. So but there's always somebody's life that can be changed. So I'm so excited because look, we're like VIP here on the Dr. Mom Show,
oh
because
no, no,
Miss
no, no, no.
Karen is
This
going,
is
Miss
no.
Karen, she is going to share one of her poems with us, sorry, which I'm so excited about. So Miss Karen, you take it away.
Okay. You know what I'm going to do? I'm going to roll it into the amputee poem as well,
Okay.
because I
Oh,
don't
look,
know
we're
if
getting a twofer here from Miss Sharon. We're getting
because I
her
don't know if
breast
there's
cancer.
any amputees out there. And my poems describe the journey of what you go through. I always put the beginning, the middle, and the end, and all my poems include God, because this is His mission, my
That's right.
assignment, and I can't lose sight of that. So the first one is called treatment, which means chemo, and the second one is called amputees lose to win. I won't stop the first one. I'll go directly into the second one because I know we're on a time situation. Okay. When you hear the word cancer, it makes you so sad. Some panic, some fight, but most people get mad. You struggle with feelings that you've never had, but treatment is available. So aren't you glad? Oh, the red devil chemo that makes you so ill. The fevers, the colds that leave you with chills. And oh, don't forget the loss of the hair. That is the thing that most women fear. And telling your family while hiding your fears, the feeling of sadness, the fight, the tears. This time next year, where will I be? The sleepless nights and uncertainty. It seems like forever the treatment will last. But as the Lord has promised, this too shall pass. Before you know it, you're over and done. And you say to the devil, ha, this time I've won. When you finish with cancer that made you so mad, you'll walk with the strut that you've never had. When you finish with chemo, probably take a bow. No hair, no eyebrows. But look at me now. Though I've been through the fire and oh, it was bad. 14-year survivor. And boy, am I glad. Losing a limb is such a life change. Life as you knew it is never the same. Waking from surgery while in such pain, while family and friends are calling your name. Knowing that you don't look the same. The thoughts, the hurt, the tears, the pain, the phantom pain that's hard to bear. The feeling like the limb's still there. The feeling like you can't go on. Don't let depression last too long. The family is grieving too, not knowing what to say or do. The friends you had, the ones who cared, have slowly left and disappeared. Oh, Father, don't you hear my cry? Of course he has. I'm still alive. Full speed ahead. Don't look behind. It's all about your state of mind. The therapist that cheers you on while all your self esteem is gone. I took 5 steps, followed by 10. It felt so good to walk again. Now I'm walking. Hey, look at me. No longer just a fantasy. Relationships you'll have again because you're more than just your limb. Embrace this life. There's only one. And look how far that you have come. Now, there is one thing I can say, it's made me who I am today. God only gives what we can bear. So thank the Lord that you're still here. Acceptance comes, new life begins, and this is how the nightmare ends.
Woo! I love it. Look, oh my goodness, such powerful
Thank you.
words. So encouraging. So encouraging. I love it. So
Thank
amazing, Miss Sharon.
you.
Beautiful, beautiful, beautiful. And if you
Thank
guys
you.
missed the beginning of the show, Miss Sharon is working on a card line that
Yes.
will incorporate her poetry
Yes.
for people who have been through cancer, limb loss, again, self-esteem. So just encouraging cards, and she's been through it. So she is, this is like true 100% real emotions here. I mean, I think there's nothing like a person who's been through a situation encouraging a person who is going through a situation.
Absolutely. And like I said, only a person going through losing a limb would understand those feelings that I put into the cards, the phantom pain, the friends
Yep.
leaving, the family. Only a person going through breast cancer will understand, or someone who's dealt with someone going through breast cancer or losing a limb. And that's the difference between my cards and the other cards are beautiful out there, but they really need to hear this is what you're going to go through.
Yeah.
These are normal feelings.
Yep.
These are feelings that you, because I didn't know what to experience. I didn't know what was ahead of
Yeah.
me, you know.
Yeah.
So I just pray that God blesses it and my cards bless everybody around me. That's it.
They will. I know they will, because your poetry itself is such a blessing.
Well, thank you.
So, well, it is time for our empowerment challenge. You guys know that season 3, I've started an empowerment challenge. So, Miss Sharon, I am going to give you the 3 topics. You can choose one and then just give the audience some words of encouragement based off of that topic. Dun, 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 empowerment challenge. So the 3
Okay.
topics, Sharon, are: 1, reclaiming our identity; 2, mastering parenthood; or 3, re-identifying your God-given intuition.
The first one. The
So
first
Miss
one.
Sharon's going to hit on reclaiming your identity.
Yes. Okay. Now, this goes across the board. um, when something happens, and ladies, let's just be honest, when you're young and slim or whatever the case is, your hair is beautiful, long, whatever your thing is, you have stretch marks, now you have children, or you had an accident like me, or you lost a breast, or you have a bald spot, whatever it is, you have to learn to work with whatever you have. And you have to be comfortable with who you are now. You cannot not continue to compare yourself to who you were at 50, who you were at 25. That person was beautiful, I'm sure, but this person is beautiful in a new way, and you've had much more life experiences. So you have to learn to be comfortable in the skin that you're in at this time. And they have so many wonderful things out here for women now to camouflage everything, hair, bellies, whatever it is, girdles, whatever it is your thing is. You have to just learn to be comfortable in your own skin and not worry about what society says and social media says. And just move forward and just, be the best you can be at that age and for your circumstance. You know, I feel I'm a better person now. I love myself even more now. And the funny thing about it is, I have much less than I did before. But I've gained so much now that I didn't have before in my 20s and my 30s and even in my 40s. So I love who I am. And also, I would tell women, not men, but women, when a man loves you, he loves all of you, and it's your confidence that they see. It's not, your weight or your incident or whatever it is that you've gone through. It's you. Because at the end of the day, if we're here, we're going to all be old one day. We're never going to look like we did when we were 20.
That's right.
So someone has to genuinely love you for you, but you have to love yourself first.
That's right. Thank you. Thank you. That was Miss Sharon. She was speaking on reclaiming your identity for our empowerment challenge. And again, I love it because the gist is, until you love yourself and your identity and people see your confidence, people will respect that. They will love who you are. So the more you love yourself, because I always use the example, if you walk into a room confident, haven't you seen that? If somebody's confident in a room, people have a tendency to flock to that person. And that's just how it is, versus somebody who may walk into the room and they don't seem as confident, their head's down, not making eye contact. But if somebody walks into the room confident, they take the attention of the room. So love yourself. And I know it's hard now. There's so much on social media, but you guys remember, so much can be airbrushed, so much can be switched. A lot of it isn't reality, even in magazines, even on TV. So much can be switched. So I love how Miss Sharon said, yes, love yourself for who you are and work with what you have. Like a lot of things we can't change. I really do like that. Work with what you have, because I know, like she said, there's so much out there now that you can do something, but love yourself and be proud of who you are. I love it. Well,
Yes,
awesome. Well,
yes.
Miss Sharon, you have your cards coming out. You're doing your poetry. Are there any other projects that you're working on?
Well, I'm trying to organize. I'm really trying to get in touch with Rihanna, which has been a challenge because she has done fashion shows for overweight, and an amputee friend of hers who passed on, unfortunately, was in a fashion show at the Barclays Center where I work. And I would love to organize a fashion show for young amputees for their self-esteem because they're gonna need it. I lost my
Yeah,
leg at 42. I didn't lose my leg at 13. That's a
that's right.
whole nother level.
That's
So
right.
I want to
I
give them a
love that.
moment to
Anything
see.
out there, if
Yeah.
you know Rihanna, or Rihanna, if you listening, girl, connect
Oh,
with
but
Miss
pray.
Sharon. Her information's up here. I love that idea. I think that's so amazing. I love it. I
Thank
have a
you.
really good photographer friend, and he wants to do something that's so awesome. He wants to do a project called Rock Your Ugly,
Hmm.
and I just love it. And you know what, ugly isn't a bad word, you know what I'm saying? But we look at ourselves and we may say, like, oh, I feel my hair so ugly, or like, or whatever is so ugly. Like a lot of times I feel like we may make ourselves use that word. But I love the fact, and he said his project is going to be about all the things like people just bringing out, like you talked about stretch marks and things like that. Like some mamas are like, oh my gosh, but you know what? That's natural. That's your scar that you had your kids. I feel like you should be proud of having stretch marks because that's your journey of part of your life that you've been through. So I love that. So Rihanna, anybody who knows Rihanna, connect with Sharon. And of course, you can connect with Miss Sharon on Instagram. Again, that's at Resilient Cards. It's all one word. Or you can email her at olivemyson@gmail.com. That information will be in the notes. And of course, it's at the bottom of the screen. So again, Miss Sharon, thank you so much for taking time on for being on the show.
Thank you. I appreciate it. I pray that my words have helped someone today. I pray that whoever was supposed to hear it hears it and they remember these words.
Oh, I know it has. I mean, I am 100% sure that it has. So thank you, Miss Sharon. And of course, thank you all for listening and watching. Don't forget to subscribe to the show, whether it's on YouTube at the Dr. Mom Show, on Instagram, that's at Dr. Mom_show. You can follow there, or if you prefer Facebook, it's just the Dr. Mom Show. If you miss any shows, you can see those on there or listen. It's on all the podcast platforms, iHeart Radio, Spreaker, Spotify, Apple Podcasts. It's all up there. And then, of course, don't forget to pre-order your copy of Dr. Mom's Ultimate Guide. I'm so excited that this book is getting ready to launch. It's something I've been working on for so long, just my journey as moms. We're so amazing at putting ourselves last. But Dr. Mom's Ultimate Guide helps us to remember who we are, and that putting ourselves first really makes our families healthier, stronger, happier, and safer. So moms, remember, put yourself first. And then, of course, again, just a reminder to connect with Miss Sharon. I think it would be great, even if you just follow her on Instagram and follow her journey. And as her cards come out, I know when her cards are coming out, I'll be like, hey, because of course I have patients who I take care of. And I think it would be so nice to, to have something like that where it really speaks to that. So again, Miss Sharon, thank you so much for taking time out today.
Thank you as well. God bless.
And then remember, everybody, life is precious and priceless. You are amazing, and you can do anything you put your mind to because you are a superhero. Remember, just have faith over fear. And of course, as Dr. Mom always says, don't forget to wash your hands, kiss your kids, love your families, and say your prayers goodnight. Bye. Have a great week. Love you guys.
Bye.